I'm from the University of Johannesburg. I'm a professor in health and sports science. My background is in sports science, but we're doing quite a bit of work at the moment within the health education and healthcare innovation spaces. Well, the real issue that we're having right now, especially within the clinical domain for students, is engagement, interaction, focus, and attention. And what we find is that gamification, or even a form of simulated-based learning, actually augments those specific aspects that otherwise traditional types of education won't be able to achieve as efficiently. So it really is a tool that has amplified the way students have been taught, with the way they learn, the way they reason, and especially how they are able to translate their skills into real-world practice. And that's one of the key aspects that we're finding is how are we able to produce better health professionals? And we're finding that a technology such as gamification, as a form of educational technology, coupled with virtual reality, has been effective in implementing that. Yeah, well, it's one of the key things I like to point out, for something that's new, in the field of mathematics, as an example, people were doing sums by hand, and then the calculator emerged, and a lot of mathematicians were averse to using the calculator because they said, well, we're not really sure if it will be receptive to how we're going to use it within our field. And now we're seeing that it's not just the calculator being used, but we're seeing far more advanced features or tools that are being used to complement what mathematicians are doing. And so slowly but surely, we will find that even within the healthcare space, that people will become receptive to various forms of technologies because they'll see that it actually assists them on a much bigger scale. We're not just talking about healthcare practitioners or the pharma space or the biotech space, but especially healthcare professionals in training. Our students in training, and peer-to-peer teaching sessions often help, where they are able to understand and conceptualize the value of various forms of technologies that can assist them. One of the key things that people are averse to is, does it actually reduce or regress the level of thinking that comes from a human being if these technologies are going to be available? And what we've seen is that a lot of these technologies can actually augment the way we do things, and it's a lot more efficient in our day-to-day processes. So exposing students to these forms of technologies will readily allow them to be receptive to these, to use these, and in the near future it will be a lot more easier for students to be receptive towards it because they will have a much more foundational understanding of what these technologies entail and the value that it can give them. So that's a dream for everyone, but for our core project right now, we've only focused on one arm within the physical rehabilitation area. And so the ideal aspect would be that if we do have unlimited funding, is to apply the same type of technology to other health sciences disciplines. Medicine, physiotherapy, occupational therapy, audiology, podiatry, speech pathology, optometry, medical imaging. There's various other health professionals in allied health areas that we would be able to gamify, but also integrate through virtual reality technologies, not just for education and training, but also to supercharge the way they work within the healthcare workforce. And the ultimate outcome from these technologies is not just training in education, it's improved patient outcomes. So it's a very patient-centric domain that will inevitably improve the healthcare workforce because people are becoming healthier.